Oh, wait. So today we're going to do a deep dive into something that I think is super fascinating, and I think maybe gets a little bit overlooked in the grand scheme of things when we talk about like health and wellness, and that is lipoproteins. Okay?
Lipoproteins, yeah.
We've all heard of cholesterol.
Right.
Good cholesterol, bad cholesterol.
Yep.
But lipoproteins are actually the things that are like carrying that cholesterol around in your blood.
Exactly.
So to kick things off, maybe give us a little bit of like a lipoproteins 101.
Yeah, sure.
What are they? How do they work? What are they all about?
So you can kind of think of lipoproteins as like these little tiny packages or like little vehicles that are going around in your bloodstream. And their job is to basically transport fats. Like cholesterol, triglycerides, all of that stuff to different parts of your body.
So it's like a little taxi service.
Yeah, like a little taxi service for fats. Exactly.
And why is that so important? Like, why do we need these little taxis driving the fats around?
Well, because fats are actually really important for your body to function properly. They're a source of energy. They help build cell membranes. They're involved in hormone production, like all sorts of really important processes.
So it's not that fat is bad, it's just that it needs to get where it needs to go.
Exactly, and that's where the lipoproteins come in.
Okay, so we've got these little taxis, these lipoproteins.
Yeah.
And you mentioned that there are different types.
Yes.
And I think this is where we start getting into like the good cholesterol, bad cholesterol conversation.
Exactly.
So break it down for us. What are the different types and what makes them different?
Sure. So the main types of lipoproteins you've probably heard of are HDL and LDL.
The good and the bad.
The good and the bad, exactly.
Okay.
So HDL, the good cholesterol, stands for high-density lipoprotein.
Okay.
And you can think of it kind of like a garbage truck.
A garbage truck, okay.
Yeah, because what HDL does is it goes around your bloodstream, picks up excess cholesterol, and takes it back to your liver where it can be broken down and gotten rid of.
So it's cleaning up the excess.
Exactly. So having high levels of HDL is a good thing because it means your body is really efficient at cleaning up that extra cholesterol, which helps prevent it from building up in your arteries and causing problems.
So more garbage trucks, the better.
Pretty much, yeah.
All right. So what about LDL?
So LDL, the bad cholesterol, stands for low-density lipoprotein. And this one is more like a delivery truck.
Okay.
So it carries cholesterol from your liver to the cells in your body that need it.
Okay.
But the problem is, if you have too much LDL cholesterol circulating in your blood, it can start to build up on the walls of your arteries.
Kind of plaque in a pipe.
Exactly, like plaque in a pipe.
Gotcha.
And that buildup narrows your arteries, which makes it harder for your blood to flow through.
So it's not that LDL is inherently bad. It's just that we don't want too many delivery trucks clogging up the highway.
Precisely.
Okay, so those are the two main ones, HDL and LDL.
But there are a couple of others that are worth mentioning.
Okay, yeah, let's hear about them.
One is called VLDL, which stands for very low density lipoprotein. And this one mainly carries triglycerides.
Triglycerides, those are another type of fat, right?
Yeah, another type of fat that's found in your blood.
Okay.
And high levels of triglycerides can also contribute to heart problems. So it's important to keep an eye on those too.
Okay, so we've got HDL, our garbage truck. We've got LDL, our delivery truck.
Right.
VLDL, which I'm going to say is like maybe a tanker truck carrying the triglycerides.
Yeah, sure, we can go with that.
Okay. Are there any other vehicles in this lipoprotein highway system?
One more.
Okay.
They're called chylomicrons.
Chylomicrons, okay.
And these are like the big cargo ships of lipoproteins.
Okay.
They're responsible for transporting the fats that you eat from your intestines to the rest of your body.
So like directly from the food you eat?
Exactly. So they're kind of like the first responders in the lipoprotein world.
All right. So we've got our garbage trucks, our delivery trucks, our tanker trucks, and our cargo ships.
Yep. That's a good way to think about it.
It's a whole system.
It's a whole system happening in your blood all the time.
Wow. That's pretty amazing.
Yeah.
So let's say I'm listening to this and I'm thinking, okay, this is all very interesting, but how do I know what's going on in my own body? Like, how do I check my lipoprotein levels?
Well, the good news is it's actually a really simple blood test.
Okay.
It's called a lipid panel, or sometimes a lipoprotein profile.
Okay.
And it basically gives you a snapshot of your cholesterol levels.
So it'll tell you your HDL, your LDL.
Yeah, your HDL, your LDL, your triglycerides.
Gotcha.
And based on those results, your doctor can assess your risk for things like heart disease.
Okay. And then I guess depending on what your results are, there are things you can do to either maintain healthy levels or get them to where they need to be.
Exactly, yeah.
So let's talk about that.
Okay.
What are some of the things that can influence our lipoprotein levels?
Well, a lot of it comes down to lifestyle factors. Things like diet, exercise, smoking, things like that.
So it's not all just predetermined genetics.
Not at all. You have a lot of control over your lipoprotein levels through your lifestyle choices.
Okay, that's good to know.
Yeah, and in some cases, there may be underlying medical conditions that can affect lipoprotein levels.
So it's always good to talk to your doctor.
Absolutely. They can help you figure out what's going on and what the best course of action is.
Okay, so let's say someone gets their lipid panel back and things aren't quite where they should be. What are some of the steps they can take to improve their lipoprotein profile?
Well, like I mentioned, lifestyle changes are usually the first line of defense.
Okay.
So that means things like eating a healthy diet.
Okay, and what does a healthy diet look like in terms of lipoproteins?
Well, for starters, you want to focus on cutting back on saturated and trans fats.
So like the fatty meats, the processed snacks, all that good stuff.
Exactly. Those are the things that can really drive up your LDL cholesterol.
Okay, so less of that.
Less of that.
What about things that we should be eating more of?
Well, there are actually certain foods that can help improve your lipoprotein profile.
Oh, really?
Yeah, things like heart-healthy fats,
Right.
like olive oil, avocados, nuts, fatty fish.
So those are good fats?
Those are the good fats. They can actually help raise your HDL cholesterol and lower your LDL cholesterol.
Interesting. So it's not all fat is created equal.
Not at all.
Okay, so diet is a big one.
Mm-hmm.
What about exercise?
Exercise is huge.
Right.
It's one of the best things you can do for your lipoproteins.
Really?
Yeah, regular physical activity can help raise your HDL cholesterol and lower your LDL cholesterol.
So kind of like a win-win.
Totally. And it doesn't have to be anything crazy strenuous.
Okay.
Even moderate exercise, like brisk walking or biking for 30 minutes most days of the week, can make a big difference.
Okay, that feels doable.
Yeah, and the more you can incorporate movement into your daily routine, the better.
All right, so diet and exercise, those are the biggies.
Yep, those are the cornerstones.
But what about those cases where maybe someone is doing everything right, they're eating healthy, they're exercising, but their lipoproteins are still not where they need to be?
Yeah, that definitely happens.
Okay, so what then?
Well, that's when medications might come into the picture.
Okay.
There are a number of different medications that can help manage lipoprotein levels.
Okay.
One of the most common types is called statins.
Statins, okay.
Yeah, and those work by blocking the production of cholesterol in your liver.
So they actually reduce the amount of cholesterol that your body makes.
Exactly.
Interesting.
And there are other medications that can target triglycerides or help raise HDL cholesterol.
So there are a bunch of different options depending on what's going on?
Yeah, it really depends on the individual and what their specific needs are.
Okay, so it sounds like when it comes to lipoproteins, knowledge is power.
Absolutely.
The more we understand about how these things work, the better equipped we are to take control of our health.
Exactly. And the good news is that even small changes can make a big difference.
That's encouraging.
Yeah, it's never too late to start taking steps to improve your lipoprotein profile and your overall health.
Well, this has been incredibly enlightening. I feel like I've learned so much today.
Glad to hear it.
So for all of you listening out there, as you go about your day, we want to leave you with this thought. Knowing what you now know about lipoproteins, what's one small change you can make today to give your heart a little extra love?
That's a great question.
And remember, this information is for educational purposes only, and it's always best to consult with a healthcare professional for personalized advice.
Couldn't agree more.